and while we're in natural environments, that we experience an easier time performing cognitive tasks, improving our mood, and we're less likely to experience stress, or that stress is more likely to dissipate quickly. So being outside, being exposed to nature, the research tells us, the existing research tells us, affects our autonomic nervous system functioning. So the parts of the brain that allow us to regulate activation um, uh, improve when we're outside versus inside. So you can see from all the research links at the bottom, and I'll put all the references at the end of this PowerPoint in case you want to follow up on any of these. These are all scholarly articles indicating that when we're outside, we feel better. And there are physiological reasons as to why. So I was really interested in, we've got some existing research that says, excuse me, I seem to have acquired a cold for my children, that being outside is good. So I was interested in, as a licensed clinical social worker, how much outside is the appropriate amount? Like if I'm going to prescribe this to my clients and say, you should go outside and you'll feel better, how much outside time should they get? And where do they need to be? Like, do they need to be like in a national park, or is an urban park good enough? You know, if 10 minutes is good, is an hour better? So all of these questions really drove my interest in how does nature exposure, we know that it's good for us. How much? How much of it do we need? And what kind? Like, is it okay if I'm just sitting? Do I need to be kind of actively? Do I need to be gardening? Do I need to be running? Um, do I need to, a super long, like a week long river rafting trip, or does a walk on my street do it? And so these are the questions that we really dug into in our research. And the kind of research that we did is called a meta-analysis, where we didn't collect original data. We crunched together a lot of existing data. So we wanted to understand, what is being outside do to adult mental health? And we specifically looked at adults with symptoms of mental illness. We also looked at adults with diagnosed mental illness. Given who you guys are, providers, administrators, I'm going to talk specifically today about nature exposure for adults with diagnosed mental illness. So let's talk about that. So we define nature as exposure as at least 10 minutes, and it had to be real nature. So there are a handful of studies out there looking at virtual nature. So some have been done by colleagues of mine looking at, if somebody's got VR goggles on and they're, compared to like a college student who, walks around a campus pond. That's a study that was done in Texas by some of my colleagues. And virtual nature does show some effect. A colleague of mine similarly did a study looking at virtual nature in the Utah prison setting. You can think of that as a nature deprived population, a population who really doesn't get much exposure to green space or to blue sky. And so they put nature scenes on the TVs instead of sitcoms in the Utah prison system and looked at the effect on the prison population. I know, I love that study so much. It's so fabulous. That was done by a colleague of mine, Nalini Nadkarni, who's an emeritus professor at the University of Utah. But we wanted to look at real nature. We wanted to look at, for the bulk of the population of the US who has access at least to outdoors, so we defined real nature had to be outdoors. And so all of the studies we looked at, we were looking at 30 years worth of data from 1990 to 2020. And they had to collect quantitative data at least 2 points in time, before the nature exposure and after. And you don't need to pay too much attention to the slide, except for perhaps to note that we began with 21,000 studies in our group of studies to be examined. We looked through 14, some of those were duplicates, about 7,000 of them. So we looked through 14,168 studies to see if they met our criteria. We ended up with 78 finally that met criteria. So they all had to do with adults. They all had samples that had adults with diagnosed mental illness and that had some real nature exposure, not virtual. So within this sample, these 78 studies, 40% of the studies focused on participants with mood disorders, little bit less than 10% focused on participants with stressor-related disorders, primarily PTSD. About a third. The samples had participants with a range of disorders. So some of these were studies that were done at like an inpatient psych unit, taking everybody to a ropes course for an afternoon, for example. So in that case, that's those studies, the participants had a range of illnesses, not any one specifically. And then a number of studies, 13% of our studies had sort of single participants with a single disorder, like binge eating disorder, for example. So I'm going to speak to all of these more broadly, but I wanted you to know who's in our sample. So we used a score that's called a Hedges G, and I'm going to translate this. It's kind of blue highlight here, but I want to translate what it means. So in our studies, we looked at what was the effect of being outside? What was the magnitude of the effect? And Hedges G is one metric that you use to calculate what's the size of the effect. And generally, you describe an effect size as small, moderate, or medium, and then large. And just for comparison's sake, I will say that antidepressants tend to have, in studies that are approved by the US FDA, tend to have a small effect size, generally speaking. So moderate, large effect sizes are fairly rare in mental health. So what we have here in the studies that were in our sample is a moderate effect size, 0.47. That's really significant. That means the likelihood that people are going to feel better when they get outdoors, even for as little as 10 minutes, is statistically significant. So, and like very likely to happen. So that's awesome. Interestingly, we have a small effect size in the studies with control groups. So some of the studies we looked at were randomized and did have control groups, meaning, some people got the nature, some people got something else, something indoors. And so you can see there's a smaller effect size with the studies that had a control group, but still a statistically significant effect size. And that's exciting to me. Again, this is about the size of a antidepressant effect that you would expect, one of the widely used antidepressants. So I think this is significant, and it suggests to me, as a licensed clinical social worker, that nature exposure is something that we should think about that might be supportive for our adult clients with mental illness. Laura, did you have something, or should I keep going?
No, keep it. Yeah.
Okay.
Great.
So I wanted to also dig into some of the different issues that we looked at. And again, I know there's a lot of numbers, so I'll narrate through this. So we were interested in, first off, did it matter whether you went for like a one big time dosage of nature, like a weekend long camping trip or a week long river rafting or whatever, or would you get the same kind of effect if it's what we called interval, rather than a one-time or continuous dose? If it was oh, I'm going for half an hour here and then half an hour another day, or like there was this one study done at the Salt Lake City VA, which took veterans with PTSD sailing. And it was an hour and a half, like every other week for 8 weeks. So that was an interval exposure. So, it's sometimes outdoors, sometimes indoors. Interestingly here, this effect size for interval is greater than it is for continuous, the one-time dosage. It's not hugely greater, but it's greater. And so I think this has really important implications for those of us who live and work in cities, particularly, which is most of us. So people who live and work in cities can't get out as easily as those who work in more rural or wilderness kinds of environments. We can't sort of get out or stay out in natural spaces. Our data suggests that interval dose has as large, and in some cases even larger, effect than continuous dosage. And I think that says to us that when we encourage our clients to get outdoors, even briefly, even as little as 10 minutes, that we're going to see a statistically significant, a meaningful effect on their mental health. And I think that's really important. And I would love to see us really prescribe time outdoors to our clients in the same time that we prescribe other sorts of things. We also dug into, did it matter what people were doing outdoors? Did it matter whether they were walking or hiking or running? Did it matter whether they were gardening or doing a horticultural program or in a forest? Did it matter if they were doing an outdoor wilderness program or doing some kind of water-based activity? And what you can see there is, in fact, there isn't an enormous difference in effect size. It didn't really matter what people were doing. These are all moderate effect sizes, whatever people were doing outdoors. And so I hope the takeaway for clients is just go get outdoors. Doesn't matter what you're doing. You want to walk, great. You want to garden, great. You want to sit, great. You want to paint, you want to play with your kids, like whatever it is, to be outdoors is good, because we did not find an effect in terms of activity. We didn't find huge variation here in terms of what activity people were doing. We also didn't find huge variation in terms of the setting. So I really thought, nature girl that I think that I am, that like wilderness was going to have a greater effect size than urban nature. And so we included urban natural environments. And we didn't find that. So what you can see is that the urban nature setting had as large an effect size as the other kinds of settings. I think the small variation that you have here in the effect sizes in the HEDGES-G are simply an artifact of the samples that we have, the particular studies that go into that. You can see the urban, there's 11 studies that go into calculating that particular effect size score. So that's exciting to me too, because again, for all of us living, no matter where we're living, I think these data say just get outside. It doesn't matter what kind of, some people have looked at like green versus blue nature. Doesn't matter if you're in like a water-based space versus a green space. It doesn't matter. That's our data. Our data says, and again, we're not collecting our own data, we're looking at existing studies, 30 years worth, and crunching their data together, and it suggests it doesn't matter where you are or what you're doing, and I think that's exciting. Similarly, you can see under sample mental illness, so this is what illness the study sample had, not a huge variation there either. Strong effect sizes for stressor-related disorders, for mood disorders, for other mental health disorders, really very similar. So I think what that says to us is that it doesn't matter what kind of mental illness my client has, that they are likely to benefit from getting outdoors, and that's exciting to me. So this slide, again, lots of numbers, but I'll talk you through it. This slide suggests that, oh, can you still hear me? Okay, good. This slide suggests that we were looking at all the different variables that these 78 studies looked at. And so what you can see is really small and moderate, in some cases large effect sizes. So for example, you can see a very large effect size of nature exposure on adult mental health and depression. That's really exciting to me because it suggests that our clients who are depressed are likely to feel better if they get outdoors. Effect sizes also suggest our clients who are anxious are likely to feel better when they get outdoors. So these are all of the variables that people examined in the studies where they were as nature exposure, and all of them showed significance. And I think that's really exciting. So it suggests that on a whole bunch of levels, in a whole bunch of ways, our clients are going to feel better. Their negative emotions are lower, their sense of quality of life will improve, their sense of being able to manage their own emotions, their sense of stress, all of these will improve in outdoor environments. Now, the thing that's frustrating to me as a researcher is that we don't know how long this effect will last. So in none of the studies that we examined was there a longitudinal follow-up. So all the studies we looked at, there was a pre-post study. So it was before the nature exposure and then after. There weren't any studies that looked at like, okay, how about a day later? How about 6 weeks later? Like, how long does this last, this effect of being outdoors? And I don't know that, because these data don't tell us that. These data tell us that if we get outdoors, we're likely to feel better. But I think these data also suggest that we're going to need booster shots of nature, that it's not like a one-time thing. It's not, you get outdoors, you feel better, and then like, great, you can go back to your regular life. I think these data suggest that if I get outdoors, that I am likely to feel better. I don't know how long that will last. And that when I start to feel stressed or anxious or down again, be a good idea for me to wander outside again. And for clients who don't live near to a green area, this can mean getting out onto a city street that's more green than it is built. And that's the standard that we used in our study is, was a natural environment, an outdoor environment more green than it was concrete or built. I'm going to pause here for please post any questions that you have in the chat, and I would love to respond to those. If you don't have any, I'll just keep going here and talking about what I think some of the implications are. So here I think are some of the takeaways. For adults with mental illness, exposure to nature lasting 10 minutes to 2 hours has had a statistically significant impact. And I didn't present these data. They're from a dosage study that we published last year using the same data set. In that study, we did not find that longer periods in nature were better. And this was shocking to me. As somebody who worked in wilderness therapy settings for years and continues to do research in those settings, I was shocked that more nature wasn't better, because when I worked outdoors, we thought a little nature good, more good. So we didn't find that in our data. What we found was a statistically significant effect up to a couple of hours, and then beyond that, no effect either in a positive or a negative direction. Now, I think there are a bunch of ways that we can understand that, and I'd love to hear people want to speculate about that in the chat. I would love to hear about that. One of my thoughts about why more nature might not be better is that the longer I'm outdoors, the more likely I am to encounter something that could make me uncomfortable. I could encounter an adverse weather event. It might be too hot, too cold. There might be buggy, might be wet. It might be what, I mean, it could be lots of things. And the longer I'm outdoors, the more likely I am to encounter something like that. So I think that's one possible explanation, but there could be others. But again, I think the takeaway here is that nature exposure and its effect on mental health is easily accessible to all of our clients. And it doesn't, none of these findings suggest you have to go on a river rafting trip. You have to be camping for every holiday break, every vacation. And these data don't say that. These data say as little as 10 minutes, you will see a statistically significant effect. And then we saw in our dosage study, we saw up to about 90 minutes, 120 minutes was the greatest effect. So up to about an hour and a half, 2 hours outdoors is the greatest effect that we saw in a time by effect dose. Beyond that, again, we didn't see it in a positive or a negative direction, the effect. So I think that's super exciting, that even short dosages are likely to be meaningful. So there was a comment in the chat, maybe the length of time in nature is due to where someone is with their mental health, like someone who's really low might not feel better outdoors. One of the things I would have loved to have coded for in our study, and we weren't able to, is whether people were alone or together. My hunch is in most of these studies, most or all, people were together, but it'd be really interesting to know, what's the effect of being outside alone versus being outside with others? Is there an additive effect if there's a social component? I would predict that there would be, but I don't know. And so that maybe would be a good place to go in future studies. So I also thought it was really exciting that interval dosage had as great effect as one-time dosage, so that these smaller, more regular doses were as effective as kind of big one-time dosage. So it doesn't mean that you need to get outside again for huge blocks of time. This is the dosage data. So nature exposure, as we found, has a significant positive effect on adults with mental illness. And in as little as a couple of hours and as little, up to a couple hours and as little as 10 minutes. It has a positive effect on mental health, affect, anxiety, cognition, depression, mood, and quality of life. And nature exposure shows these positive effects no matter what kind of nature you're in, if it's, water-based or if it's an urban environment or a wilderness environment. And no matter what you're doing in nature, all of the activities that we coded for had positive effects. So I think that these studies have particularly important implications for all clients that we're working with, including our clients who have an harder time getting to natural spaces, clients who perhaps live in areas where their access to treatment is lessened or their access to green spaces are lessened. If those folks can find their way to an urban green environment, our data suggests that they're likely to experience some relief from whatever symptoms they're experiencing of mental illness. So I would love to, if you guys would post in the chat, like what are some of the ways that you imagine you could integrate outdoor time into your own clinical work at your agency, in your practice, in your organization? Some of you may already work in outdoor and nature-based settings. If you don't, how can you bring outdoors to your clients? I would love to hear from folks what they think. And Laura, maybe I'll pause there and ask for your thoughts. What do you think?
Yeah, well, I think, I mean, to me, it just, all of these results really speak to the idea that we don't have to get super complicated or super clinical about the impact of nature. It doesn't have to be this, controlled, prescription, let's say, or part of a big wilderness therapy 90-day event to help people. The simple fact is when people get outside, they feel better. And I think like all of these results, it's almost undeniable the numbers you're showing. And I know a lot of people here, like their eyes glaze over when they see numbers, and I don't blame you for it. But to me, it's like, wow, those effect sizes are really, really impressive. And so when you think about a typical treatment impact, a 0.3 would be like across all literature is a typical treatment impact, or the magnitude of the impact of therapy, or any kind of medication therapy, you name it. And to see a lot of these numbers were double that, just stepping outside, it's really like just really profound, and it just doesn't have to be complex. And so that's what's really screaming at me from all of this. And now we've got some comments, so we could address these if you want to.
Yes, absolutely. I think, creating there are some real challenges in um, bringing outpatient um, group work outside. It's tricky. I think it's maybe easier in residential settings where the residential program might be able to create a physical space that's outdoors. With a lawn, with some bushes, with some trees, where a group could gather. But in outpatient, I think there are some, um, uh, potential challenges. So, for example, um, the there's some folks I've been working with in Maryland who run an outpatient agency, and I was saying to them, well, like, what? So typically, the way that they do it, nature exposure for their outpatient clients is they do like walk and talks. And I was like, well, but what do you do if your client runs into somebody they know? If you run into somebody that you know when you're walking and talking in the neighborhood, like, haven't you just compromised confidentiality? And so they have paperwork that they use to ask for clients' permission to do this intervention, this walk and talk outside of clinic walls. And they agree between the client and the clinician, how are they going to handle it if they run into somebody they know? So they talk about it ahead of time. They kind of brainstorm, where are we going? What will we do? And what will happen if we run into somebody that either one of us knows? How should we handle that? How do you want to handle that? Are we just two friends going for a walk? Like what are we going to say? What are we going to do? And so they have both sort of the paperwork as well as the sort of dialogue around what happens when we get outside clinic walls and we get into a natural space, which I think is really best practices in terms of handling this. I love the comment that the RTC works hard at getting the clients outdoors. I absolutely agree. Behaviors are different outdoors. Um, yeah, I love that so much. At a residential treatment center, the counselor takes clients for a walk at an early morning walk at a woodsy park and then gathers and people together for dialogue. I love that so much. I think that's a great use of outside, and some of the things that our data suggests, and as well as other research previous to ours, suggests that um, Clients find it easier to regulate in outdoor environments. So it makes sense to me why I might have a more productive dialogue with my client in an outdoor space because they're going to find it easier to regulate. And they're not going to be conscious of that. They're not going to be able to describe that, but they're simply going to feel calmer. We know from prior studies using physiological measures that people's heart rate slows when they're outdoors versus indoors. Their cortisol levels go down, their respiratory rates go down in good ways, indicating lower stress. And so I think all of the having a client who feels calmer and more centered is oftentimes a productive place to talk about something that's painful, that's hard. Um, yeah, I love the comment in the chat. I do walk and talk with outpatient clients. I think again there are barriers to overcome, but it's totally doable. So I'd love to hear for those of you who haven't been able to get clients outdoors or who have and have worked hard to do it. What are some of the barriers that exist there in terms of getting our clients outdoors? Because I think, in traditional healthcare, there are those barriers. What makes it hard for us to get our clients outdoors? Anybody have thoughts about that? I think sometimes there are physical barriers. So my agency is in a space that doesn't have a green space near it. So I don't have what I have is a super urban environment. And I don't have a nice street with a bunch of trees on it and greenery and things like that. So I think there can be physical access barriers. Um, totally. I think, yeah, go ahead, Laura.
I mean, I think just logistics are real. When you have your hour, and you want to incorporate something like that, I think it feels a little overwhelming to think, how am I going to have a productive session and get where I want to be in this 50 minutes or hour, and include the time to get outside, talk about being outside, and do all of the other logistical things. And so I think unless you really see the value of being out there, it's gonna feel like there's not a great cost benefit ratio.
Yeah.
Mhm.
Yeah, absolutely. I think, and for clients, many clients are really used to treatment that's delivered indoors. There's a comfy chair for me to sit in. Like um, so let's go into an outdoor environment is not necessarily the easiest thing to do with someone that might, there's a comment in the chat, motivating them to participate in outdoors is a challenge, and that makes total sense to me. It's there are motivational barriers to overcome here in terms of clients. Absolutely. I was going to just mention briefly, I did a study that was just published this last year with folks at the Salt Lake City VA, and we looked at a mindfulness intervention delivered indoors at the VA compared to the same intervention delivered outdoors at a local arboretum. And what we found was we didn't find statistically significant differences in terms of the mental health outcomes of the two groups. It was veterans with PTSD is who we were studying. And this 6-session mindfulness intervention, we did find that there were nobody dropped out of treatment in the outdoor group. We had real problem keeping people in treatment in the indoor group. So sometimes being in clinic walls, particularly, veterans are a tough population to treat because there's oftentimes a ton of stigma, both overt as well as sort of more subtle stigma around getting treatment. And so having people come into the VA is oftentimes like, I don't want to go there. I'm not one of the sick ones, and I don't want to be seen going into that space. Getting mental health care. And so oftentimes I think being outdoors is treatment that doesn't really look like treatment. And I love that about it too, because I think for some clients, that can be really appealing. Um, yeah, someone put in the chat that there's both sort of some client resistance to getting outdoors and doing walk and talks, and also either don't bring or say that they don't have appropriate weather gear. So I think gear is another barrier. Weather's a barrier. Is if it's wet, if it's cold, if it's right, like so either a client doesn't have or doesn't want to bring the gear to be safe in an uncomfortable or potentially uncomfortable outdoor environment. So I think those are real barriers that need to be addressed in order for us to be successful in these kinds of interventions. And so I think it's awesome to integrate nature in your practice. Another way to think about the implications of these findings is to prescribe nature. So to give it like homework, like you would give other kinds of homework to your clients. So some body of literature calls this park prescription programs. And this is a way to really, it asks park prescription programs ask healthcare providers to prescribe nature in the same way that you would prescribe anything else. For a depressed client, there's a significant body of literature suggesting that exercise is likely to help depressed clients feel better. And so sometimes clinicians will prescribe exercise to clients. So could we prescribe time outdoors? Well, there's some tools that exist to help us do that. So we can link a nature prescription to our clients' treatment goals. So this website, parkrx.org, takes you to a national nonprofit that has a range of tools for healthcare providers as well as for clients and families. So one of the things that that website offers, parkrx.org, offers is a little prescription sheet. This is one that I pulled off the web, but there's a prescription sheet that you can pull off of ParkRx that you would give to your client as a part of a park prescription, and it would tell them, before your next appointment, where should you be going? What green space? How often should they go there, and for how long? You might even want to prescribe and brainstorm with the client, who should they go with? How will they get there? What will they do once they get there? What are the barriers that exist? So is it like, oh, I need bus fare, and if I don't have bus fare, I'm not going to be able to get there, or I don't know where to go. I don't know, what's the best green space for me, or there's a green space near me, but I don't feel safe in it. It's not well maintained. There's activity there that makes me uncomfortable. So this is all, if you're going to use a park prescription with your client, and I strongly encourage you to, I would write it down. And again, you can get that off of parkrx.org, just a prescription sheet, or you could just make up your own, something that looks like this. But it should be super specific. And the more specific it is, and the more clearly it addresses the barriers that exist for your client in getting outdoors, the more likely it is, I believe, that they are to follow it. And I think this is one of the real implications of this research, is that we begin to think about, I love everybody that put in the chat, like, here's the ways that I'm integrating outdoors within my practice. But I think another way to integrate this research into practice is to think about, can I prescribe nature to my client? Can I say, you're likely to feel better if you get outdoors, given your particular diagnosis? And you can go as little as 10 minutes. And so let's think about, where's a green space near you that you could get into? And what are the barriers to you getting there? Let's see if we can figure some of that out. And then we're going to write all that stuff down, and I'm going to give it to you on a prescription pad so you can take it away as a reminder. And then this is homework. We're going to check in next time I see you about how that went. And so for those of you who face a lot of barriers in getting your clients outdoors during treatment, during sessions, which makes sense and is reasonable to me, this is another way to integrate these findings into practice. This is a graphic that is available on the ParkRx website. I'm just putting it up here so that you are aware that ParkRx has a whole bunch of, this is intended to be put up like on a poster in somebody's office. And it's free, and it's just available on their website as part of their toolkit for prescribers. And it basically says, like, here's some of the research that suggests why getting outdoors is a good idea. In case you're having a tough time kind of convincing or explaining to your client, why is it likely to be helpful? And actually, is there research that suggests that it is? This just this come on a like woo-woo thing that you came up with? Like, there actually is research on this, and that's why I like this graphic that they've created. Again, available to everybody free on their website. So one of the things that I want to mention is around green equity. So green equity is really, it's a concept around who gets access to nature. And some of the things that we know, and I really can only speak to this in a US context because that's the research I'm most familiar with. The Trust for Public Lands, which is a large nonprofit here in the US, collects and analyzes data in urban environments within the US, looking at who has access to nature. So in Salt Lake City, where I live, 85% of residents live within a 10-minute walk of the park, of a park, any park. Which is awesome. But if you live on the west side of Salt Lake in West Valley City, only 57% of those residents are within a 10-minute walk of a park. So that's this gray line and the purple, that's West Valley City. That sort of purple part over on the west part of Salt Lake. And what you can actually see, you can see it pretty well here. This is the whole Salt Lake Valley. And what you can see on the right side of that map is a whole lot of green spaces. So people who live on the east side, that's me, I live on the east side, tend to be more white. We tend to have more money, and we have a lot more access to green space than people who live on the west side. They don't have those nice mountains right there. They don't have county maintained trails, and it's harder for them to get to a park. Only 57% live within a 10-minute walk of a park. So when we think about nature equity, we're really talking about who gets outdoors and what kinds of barriers do they face. And I feel enormously privileged that I get to live in a space where I can walk outdoors and there's trees right there and there's trails right there. And I'm enormously fortunate. So, and we definitely should give some thought to who gets to go outdoors and what are the barriers that they face in getting there. So I put my email up there. I can put it in the chat as well if you're interested in copies of the studies that I'm referencing. I want to say a couple of caveats about the research that we did. So we didn't include some studies that didn't seem like we weren't totally sure if they were in Nature. So for example, there was a psychiatric unit that was specifically for dementia patients that had a wander garden. That's what they called it. And we couldn't tell, it was a locked psychiatric ward. We couldn't tell if it was actually outdoors or not. With a lot of the horticultural interventions that were published, we couldn't tell if they were gardening indoors or outdoors. Farming, same things. For some farming can be outdoors. And so there were plenty of literature actually on farming interventions that we weren't able to include because we weren't sure how outdoors or natural the green the environment was. A lot of studies didn't include data on the nature intervention. So one wrote that the nature intervention was near nature. And as a research team, we were like, we have no idea what that means. What does it mean to be near nature? And so for our study, we were only looking at actual nature. Well, one of the limitations of our study is also that we weren't able to report on for whom nature is most useful. So we really wanted to report on some of the age, and we did have a little bit of data on gender that I didn't report here, but we couldn't report at all on race or ethnicity of participants because typically the studies we were looking at didn't report that data. And that's frustrating for me. I would really like to be able to say to you, here's who specifically who is likely to benefit most given the research that we analyzed. And again, I'm not able to speak to the long-term effect of nature exposure, and I really wish that we could, because I think as mental health providers, we want to know, like, okay, you're going to take the pill, how long is it going to last? So we don't know how long the nature exposure pill lasts. And I have sort of intuitively my own experience of that, but I don't want to generalize that to everybody. I don't know what everyone's experience outdoors is and how long those positive effects last. Here are 4 studies on which the presentation is based. And again, I can put this all in the chat. Some of these are available full text free. So through the DOI link. So I will put this in the chat as soon as I'm done speaking. Here's the other references used in this presentation so that you can see there actually is research on which this stuff is based. So I can put all of this in the chat so that you guys have access to it, but I want to just pause here for questions in our last 10 minutes or so. I'd love to hear questions from anybody in the audience, as well as Laura. Do you have any questions? Well, folks are putting questions out there. Anything that you would like to ask about?
Well, I had a question. You found that short intervals are the same or maybe even better than the comparison, which was like a longer term, right?
Yeah.
Longer term in the wilderness. Any thoughts on why? Do we have any thoughts on why that could be?
Why longer wasn't better?
Yeah. Well, I mean, you did say because of the you're more likely to encounter discomfort there as well. I guess what I was thinking is, do you think like the impact, it sort of wears away? Like, do you start taking it for granted so that the impact on your mental health is sort of deteriorates over time as you just, are exposed and take the place for granted?
Yeah, I think it can be stressful. I think being outdoors can be stressful. I like it, and there are plenty of times when I've been outdoors and it's been stressful. Um, there's a lightning storm, there's a rainstorm, there's a whatever it is. So, but that's just a guess. I don't know that for sure.
Yeah.
Um, I'm going to post some of the studies and their links in the chat. Um, yeah, so I really wish I knew. I feel intuitively that more nature is better, but that's not what we found.
And I guess another question I have, and I mean this is beyond the scope of the studies here. I would be super intrigued to understand the impact of nature exposure on family functioning for families who spend time in the outdoors versus families who don't, or various combinations of those two groups. I think I get the sense that families spending time outdoors would just be there are just opportunities for conversation that sort of naturally happen when you're outdoors. What are your thoughts on this?
I absolutely agree. I think outdoors is an awesome
Mm.
environment for family work. Again, because, one of the things that we know is that people are calmer, whether they're people with diagnosed mental illness or they're people without mental illnesses at all. The existing research suggests that our autonomic nervous system um, functions better in an outdoor environment, that we're less activated, we're better able to re-regulate and use our kind of existing coping skills in an outdoor environment than in an urban environment. And some people hypothesize that urban environments are very stressful for us. They're loud, it can be a ton of stimulus, and that it can be really hard for people to kind of regulate themselves. And so I think when you think about family work and how activated people can get, I think doing family work in outdoor environments is a great space because you're going to have people that are going to feel less stressed and calmer. Given the research that we have, if you can find us, and again, there are barriers here, right? Like, I need to create a space that's out of the intense sun, that's out of the intense cold. Like, I'm going to have to deal with some weather barriers. I'm going to have to make sure that I can create a space where confidentiality can be maintained because we're going to have probably an intense dialogue, and I don't want to have that in front of random people out in the world. So, if I'm an outpatient or a residential facility, can we create a space that's outdoors that still allows us to preserve confidentiality? Because I think that's a hurdle.
Yeah, that's a great point. Any other questions from the attendees?
We do have a question. Dr. Schaefer, in your research, have you found the time of day outdoors, such as viewing the sun within an hour of waking, does that have a greater impact on the health benefits?
That's a great question, and I don't know any of that research, so I'm not the best person to answer that question. Like, does time of day matter? Like, does early morning nature better than later nature? Um, the studies that we looked at didn't include that as a factor, but again, we were just looking at time outdoors. And so we didn't consider it. I think, my sense of humanity is that some people are morning people, some people are evening people. So there might be some, I don't know that I would answer that in without knowing the research in a universal way. Like, everybody should get outdoors in the morning. I think my research suggests that people should get outdoors when they want to get outdoors, and that as little as 10 minutes whenever they're able is likely to make them feel better. And so there's nothing that we found that suggests that it has to happen at a certain time of day. But again, I'm not familiar with research around timing of time outdoors.
Oh, we have one more comment here on green equity, green nature equity.
Yeah. So Oh, it's so interesting. So there is some literature around bringing the outdoors inside. So I was just uh, the Nature and Human Health Utah group is a community group that I work with now, and we offered a pilot grant to a student who was working with a faculty member to do a study at a local university here. They wanted to see if they put plants in some classrooms, would the students in those classrooms do better than the plants than the classrooms with no plants? And they don't have any findings yet, but I'm really interested to see. There is some research suggesting that it's possible to bring aspects of nature indoors. So for example, some of the early studies, these were done like 30, 40 years ago, studies of nature looked at patients in a hospital viewing nature outside of a window. And they showed that when patients had a nature view as they were healing, they healed faster than the patients with only an urban view or a wall view. And so we would call that passive kind of nature exposure, where I'm looking out a window. I'm not actually in it. I'm indoors. I'm healing from surgery or some major medical event. That has a positive effect. So similarly, some research suggests that having plants, having animals, that all of these things decrease stress, decrease anxiety, improve regulation for humans. So I'm a big believer in plants and animals in indoor environments, and there is research that supports that as well.
Well, Dr. Schaefer, thank you so much. This was amazing. I think the results sort of speak for themselves, but you put it together in a way that made sense to me and hopefully to all the viewers. And super reminder for me that if I have 5-10 minutes before a Zoom meeting, I should zip outside and just take some fresh air instead of trying to get through, the next project. Just to make myself maybe more cognitively clear and ready for the next task. But anyway, excellent presentation, and thank you for coming, and we look forward to hearing more from you in the future.
Thank you so much. It was a pleasure to be here with you all.